Attention deficit hyperactivity disorder, or ADHD, affects how people think, feel, and respond to their environment. It manifests itself differently in different people, but some attributes are restlessness, forgetfulness, trouble getting along with others, disorganization, excessive talking, or daydreaming. In 2016, the CDC estimated that 6.1 million, or 9.4% of children in the US have been diagnosed with ADHD. Now they estimate that 11% of children and teens in the US suffer from it. You can see from the map where the highest prevalence of ADHD diagnoses are. You can also see that the state of Utah has way fewer diagnosed cases of ADHD than other parts of the country, to the tune of 5.2% compared to 10 to 15% in other parts of the country. Is this because of the awesome opportunities to explore the great outdoors in this state? One psychiatrist claimed that Utahns aren't underdiagnosing, but that other states are likely overdiagnosing their children with ADHD. Most children are school-aged when they are diagnosed with ADHD because their symptoms become more apparent to teachers and parents as they struggle to focus and sit still in class. As many as 85% of children retain impairments associated with ADHD well into adulthood, even though hyperactivity tends to decrease. And just to clarify, because I didn't know this before writing the paper, but the term ADD is no longer used. Whether or not the individual has symptoms of hyperactivity, ADHD is the official medical term used today. Some individuals are now considered having ADHD with quantifying subtypes of primarily inattentive or primarily hyperactive impulsive, or combined. I chose to research ADHD because I'm convinced I have a degree of ADHD, as do some of my children. One story talked about a mom having to ask her child multiple times to complete a task. Here, I thought that was a completely normal part of parenting. I do wonder with my own kids, though, if it's ADHD or just selective listening. I would laugh to myself during my research as I read stories that I could so easily relate to. I used to walk and read, partly to stay awake, but also so that I could process the information better. But I've learned in looking for slides for this project that I need to take up a new hobby of biking and reading. But I digress. Now, what was I talking about? Another personal experience I have with ADHD is a girl that I worked with at church. She would take medication on school days, but by afternoons, the medication would wear off. She was super talkative and active, yet when she was working on a craft or a project that she really enjoyed, she could focus for extended periods of time, and I was so impressed with her ability to do that. Still, it would be nice to decrease the risk of getting ADHD. Here are a few things to avoid doing in order to keep risk factors down. Lead and other environmental toxins, maternal drugs or alcohol use, and smoking during pregnancy are all things that can lead to ADHD, as does screen time. It should be limited for children under age 5. Difficulty focusing on schoolwork and learning disabilities are common outcomes for individuals with ADHD. This can lead to academic failure, which can lead to challenges maintaining a job. This trajectory can lead to low self-esteem. Disruptive behavior disorder, anxiety, Tourette's, and mood disorders can lead to challenges in relationships. Antisocial personality disorder associated with ADHD can lead to higher rates of depression and anxiety. Impulsive behavior can lead to higher arrest rates due to aggressive offenses. Individuals with ADHD often have other mental disorders such as oppositional defiance disorder, substance use disorder, autism, or anxiety, including obsessive compulsive disorder. Therapy, medication, or a combination of the two are the main forms of treatment for ADHD. It's best to work closely with healthcare providers, therapists, teachers, coaches, and family members of the individual with ADHD to determine what form of treatment will best suit their needs and circumstances. Psychoeducation helps patients make sense of their ADHD. Behavior management includes giving small rewards to encourage the desired behavior and removing privileges for poor behavior. Social skills training teaches children how to behave in social settings and learn consequences of the behavior. Cognitive behavior therapy works to help patients change the way they feel about their situation. Parenting training empowers parents to know how to address ADHD in their children. They learn behavior management skills, how to talk, work, and play with their children to improve their concentration. They learn effective uses of timeouts. It's especially useful when working with children under the age of 6, as medication in young children seems to have more side effects than medication in older children. Stimulants are the most widely used ADHD medication. Methylphenidate is the most common stimulant used for treatment, activating parts of the brain that control attention and behavior. If stimulants are not working, some doctors prescribe non-stimulant medication, which increases norepinephrine levels in the brain. helping improve attention and memory. Diet may also improve symptoms of ADHD, yet the jury is still out on the effectiveness of dietary changes. Some experts recommend eating diets high in protein, complex carbohydrates, omega-3 fatty acids, while reducing consumption of sugar and other refined foods. There are many stories available of individuals with ADHD struggling to focus in college or on tests, buying impulsively, feeling rejected, or struggling in relationships. There are real challenges associated with ADHD, yet some individuals have learned to lean towards their strengths and find ways to manage their weaknesses. Brian Scudamore is one of those individuals. He is the founder and CEO of O2E Brands, which franchises 1-800-GOT-JUNK, Wow, One Day Painting, You Move Me, and Shack Shine. At age 18, he started his first business. A few years later, he quit college to focus on his business. His high energy and impulsivity help him come up with business ideas quite readily, but he knows that many aspects of the business are not suited for him. He knows his strengths and his weaknesses and which responsibilities to delegate to the COO to make his business dreams a reality. Brian has also learned that movement helps him focus better, and working in busy places helps him think more clearly. Knowing how to draw out his strengths and how to manage his limitations has allowed Brian to be successful in spite of the limitations of ADHD. Asking anyone with ADHD, they can learn to draw out their strengths and manage their weaknesses. And those that are working with people struggling with ADHD can help them to lean towards their strengths and give them hope and opportunities for success.